on here and say this, and I'm going to get so much shit for this. This is literally something that I just learned from a patient. And I'm pretty mind blown every time I come on here and say something that I'm like, oh, like people might think that's stupid. There's a lot of people who find it helpful. So I'm here to share. I don't know. They never said this in school. I was never told this in any of the orientations that I've done. And my patient said that she didn't know this for years until she went to her ENT, but no other doctors had ever told her to do this, or hospitals or like nurses or anything. But my patient last night had this same nasal spray, and I told her, I was like, oh, my doctor prescribed that to me recently, but I've only used it a couple times because honestly, like, I cannot stand how it tastes, and it like lingers, and my mouth, like throat, whatever, it just tastes terrible for like hours and hours. And I'm like, no, can't do it, not worth it. And my patient's like, you shouldn't taste it. And I'm like, what do you mean? I taste it like almost every single time. She's like, what you have to do, and I've already done this twice and it stopped recording, so I'm not gonna actually do it. She's like, what you have to do is sit straight up, put your chin to your chest, keep your head down, double chin, and spray, sniff. And she's like, and then you should not taste it. And I am freaking mind blown because literally I did not taste it. I did it that way. I was like, how do I not know this? I've never seen a patient do their nasal spray like that.
My name is Dr. Rubin. I'm a board-certified allergist, and she's right. Most people aren't taught how to use a nasal spray properly. I have talked about this before, but I'm going to show you again how to do it because there are a few caveats to what she was saying that I want to clarify. So yeah, I do like it when people put their nose to their toes, and instead of just blindly pointing the spray, you actually want to place it slightly out towards the ear on the same side. You don't want to point it towards the middle, because if you point it towards the middle, you increase the risk of creating nosebleeds because there's a lot of blood vessels that are lining the septum, or the part that separates the two nostrils. Where most of the inflammation is going is actually to this side of your face. So when you look down, instead of placing it up, slightly out towards the ear, when you spray, you could sniff gently a little bit, but if you just breathe normally, it'll likely stay where it's supposed to go. If you taste it, you're wasting it. So again, out towards the ear, out towards the ear, breathe normally. If it's starting to drip out the front, you can tilt your head back a little bit. If you start to taste it, you can look down. And that's going to significantly help. Now, bonus points, if you rinse your nose out prior to putting nasal spray in, then it's going to be more effective because you're removing the mucus from the tissue and then you're putting medicine on fresh tissue.